Hi, I'm Hamilton County Health Commissioner Tim Ingram, and happy 100th year anniversary to Hamilton County Public Health. Public health has been the critical driver in adding years to life expectancy in the United States. In fact, public health has been credited with adding 25 to 30 years to life expectancy over the last century. For the next few minutes, I'd like to introduce you to some of the work we do every day at Hamilton County Public Health. You may be very familiar with our programs, or perhaps we could provide you with a few surprises. We are fortunate to have a dedicated and caring team of public health experts serving you.
Maybe the term public health makes you think of restaurant inspections or flu shots. Maybe you think of the health department as the place you go to get a copy of your birth certificate. But Hamilton County Public Health is much more. We provide a wide range of services for residents, communities, and businesses. We'll start with epidemiology, the backbone of public health. As Hamilton County Health Department, our team of epidemiologists monitors the health of our community. They collect, analyze, and report data on things like deaths and births, infectious diseases, overdoses, and injuries, all to identify potential threats to the health of our community. Epidemiology gives us the data we need to develop, implement, and evaluate the effectiveness of programs to prevent disease and promote health for everyone in Hamilton County. Every day, our disease prevention staff works to prevent and control the spread of diseases that can be devastating to you, your loved ones, and the health of our community. This means free HIV testing, linkage to care, and notifying partners of potential exposure. We also offer free testing for other sexually transmitted infections and monitor new cases to prevent the spread of diseases. We provide tuberculosis testing, and our trained staff works with those who were diagnosed with TB to ensure that medication required to prevent the spread of the disease is taken. To decrease the harmful effects of drug use, Hamilton County Public Health is meeting people where they are.
The van goes to multiple locations throughout the county. It's a needle exchange, a syringe exchange. It's a one-for-one exchange to get dirty needles out of our community and disposed of and removed properly for all of our safety. I have not met clients in this position with a substance use disorder that are satisfied with the quality of their life or the way that they try to manage day-to-day living. But when we are offering assistance like the van, like connection to treatment, I think it helps the community in a bigger role because it lessens the exposure and the risk that we may have to those diseases like Hep C and HIV if we're providing services to connect people to treatment for those.
A young lady was outside and she came up and put her hand on my shoulder and said, "Hey, can I get some help?" And we said, "Absolutely." So we got her in on our truck, did services for her, and then got her to the point that we got her into treatment and then have followed her through that process. It's very gratifying knowing that we've helped one more person on the street here.
In 2018, we collected nearly 400,000 used syringes, and that alone provided high levels of safety and wellness for all of us in the community.
A healthy and safe Hamilton County also relies on things that we now take for granted, like proper waste disposal, clean water, and safe food. That's why our environmental health services are so important to the overall health of our community. You may not give much thought to what's going on underneath the ground, but we do. The county's vast sewer system was developed to take waste and stormwater out of the streets and away from our homes. Early on, Hamilton County Public Health recognized the need for plumbing regulation to ensure clean drinking water and appropriate disposal of waste. Today, our certified plumbing inspectors work with residents and contractors to ensure the safety of our water supply. As rural areas of Hamilton County were developed into residential communities where the sewer system did not reach, individual sewage treatment systems or septic systems were installed. This was a good solution at the time, but these septic systems have to be maintained. Today, our staff completes annual inspections to ensure that homeowners are properly maintaining their septic systems. Incidentally, the inspection program began with a citizen-driven initiative to work in the western part of the county to eliminate faulty septic systems causing pollution in streams and yards in the area. This citizen-led initiative ultimately led to one of its leaders being named to the Hamilton County Board of Health. At one time, nearly every community in Hamilton County had their own town dump, with little oversight or regulations. In some cases, this led to contamination of ground and surface water and the release of harmful gases from the waste, not to mention the potential spread of diseases. Today, most waste in Hamilton County goes to the Rumpke Sanitary Landfill. Hamilton County Public Health inspects and monitors the landfill and other solid waste disposal facilities. Hamilton County Public Health has always been considered a leader in food safety. Some of the first regulations adopted by the Board of Health were intended to protect the county's milk supply and food trucks. In 1963, Hamilton County received the Crumbine Award, a designation given to the best food safety programs in North America. We received the Crumbine Award again in 2013. While all health departments are required to follow state food safety rules, we take this a step further with our food safety education programs for restaurants and schools. Our efforts to educate and work with licensed food operators is unique to Hamilton County Public Health.
In December of 2018, in the middle of my holiday baking, there was a knock on my door, and I went to the door with my apron on in the middle of baking and opened the door to two men in brown uniforms who identified themselves as health inspectors from the Hamilton County Health Department, and my heart dropped to my toes. I thought, oh my gosh, they're here to shut me down, you know, and we were in a period of, we needed every single dollar that was coming in from those pies to keep food on the table. So what they said was, we don't want to shut you down. We want to help you do this the right way so that you can be successful.
Hamilton County Public Health's Clean Kitchen Award is given to restaurants and schools that do the most to provide a safe dining experience. Winners are recognized by the Board of Health and given a certificate that they can proudly display at their business. At Hamilton County Public Health, we understand that where you live impacts your health, safety, and well-being. This was the case with Valley Homes in Lincoln Heights.
One day, I was tutoring, and I thought, before I parked, let me go through the Valley Homes parking lot and just reminisce, because I grew up in the Valley Homes and many of my family members. And as I went down the parking lot, I was in shock. I saw some of the buildings had holes in them, the doors hanging off. I was horrified. I started crying and said, hey, we got to do something.
We worked with the community to protect residents from these unsafe and unhealthy housing conditions. Valley Homes went on to be redeveloped. What once posed a risk to people's health is now a much-needed, affordable, safe, and healthy housing community.
I'm grateful to the health department for doing that, and you know, from there the relationship grew to the Village of Lincoln Heights becoming one of the first three communities to get involved with We Thrive, and we've been thriving ever since.
Housing is important, but one of the most crucial indicators of the overall health and well-being of a community is infant mortality. The Fetal and Infant Mortality Review, or FEMR program, examines social, economic, cultural, safety, and health system factors that are associated with fetal and infant death. Interviewing moms and families of babies who die before age 1 provides important information on the root causes of infant mortality. The FEMR program also helps facilitate the grieving process for families and connects them to support agencies.
I will go to the mom's home if that's what she wants, or we will meet somewhere out in public and we will conduct an interview.
It's a very emotional moment for the mother as well as the interviewer. We really take it as an honor to be able to extend our services to them here in Hamilton County.
We gather the information and we bring it back, and we have a team meeting. And in the team, we'll discuss the case, we'll talk about the strengths, the weaknesses, some common threads between the cases, and we're trying to gather the data to see if we can make a difference in the infant mortality rate here in Hamilton County.
As you can see, public health is a part of your day-to-day life, but we're there in case of emergencies as well. Hamilton County Public Health serves as a leader in the response to public health emergencies. We will provide medication or vaccinations to populations exposed to pandemic flu, anthrax release, other biological releases, or infectious disease outbreaks. When needed, we open point of dispensing or pod sites across the county in order to provide medications or vaccinations in an organized way. Near the beginning of this video, we told you how data from our team of epidemiologists helps us decide where to focus our efforts. Our health educators share that data with communities in Hamilton County and helps people like you take action to make healthier living easier. Making healthy living easier for all residents of Hamilton County is what the We Thrive initiative is all about. What started with 50 people in 3 communities in 2009 now impacts more than 270,000 people throughout 25 communities. And We Thrive is still growing. Working with our health educators, We Thrive communities look for ways to improve the health and safety of their community. Teams of residents and community leaders choose one or more pathways to focus on, like substance abuse, social health, injury prevention, environmental health, emergency preparedness, and chronic disease. We Thrive also works with schools and child care providers because our children deserve a healthier start in life. In 2017, We Thrive was recognized as a model practice by the National Association of County and City Health Officials. The award honors programs that show how health departments and community partners can effectively collaborate to address public health challenges. Thanks for joining us in celebrating the 100th anniversary of Hamilton County Public Health. We hope you've enjoyed this look at how public health makes a difference in your life every day. As we look to another century of serving, educating, and protecting our community, we're committed to excellence. Our Board of Health invests in the development of staff through a workforce development plan and training for all staff on the principles of continuous quality improvement and performance management. In 2017, we became the first health district in southwestern Ohio to achieve accreditation from the National Public Health Accreditation Board. As we work to maintain the level of excellence required to earn this accreditation, we're constantly looking for ways to improve the services we provide so that we can continue to positively impact your health and your quality of life. We invite you to keep up with the things we're doing to make a difference in Hamilton County by visiting our website and following us on social media.